If it seems like everyone around you is getting the flu, you may not be wrong. Rhode Island is having a bad case of the flu, also known as influenza. Year visits for the flu were less than half a percentage point in November. That has now jumped up to 7% as of the first week of January. Hospital admissions also have spiked, from 24 in November to over 460 since December. There have also been 7 deaths due to the flu. In fact, if you go to most hospitals these days, you may be required to wear a mask. One of the reasons is we just went through the holiday season, and people gathered, and that's how the flu is usually transmitted. Another reason is seems to be lower immunizations, particularly among children. The main reason why infectious diseases doctors say that the flu is bad this season is that it went through genetic changes, which have made it more resilient against immunization. So what can you do to take care of yourself during the flu season? The one thing that infectious diseases doctors and the Department of Health is urging people to do is vaccinate. Though the vaccine seems to be less effective at preventing spread, it still helps stem serious disease and illness, especially among people who may be immunocompromised and who may be elderly. And they emphasize it is not too late to get vaccinated, even though we're still in the middle of the season of the flu. Another thing you can do is you could simply mask up, use hand sanitizer, and try to avoid large gatherings. Now, there are no hard and fast rules for when exactly you should go to the ER if you have the flu. But if you're having feelings like trouble breathing, feeling dehydrated, unable to eat or drink, or persistent fevers and cold, it may be time to seek medical attention. Infectious disease doctors have said that if you can get medication like Tamiflu or something like that early on, it may help prevent a more serious illness. Oftentimes you just have to ride it out. But if it gets more serious, like those symptoms that I just described, it may be time to get medical attention.